So I welcome also our audience back for the last sprint session, so to say, of this very interesting day. And I'm very happy now to introduce to you Pascal Borry. We already discussed yesterday, but also today, that one of the major challenges and maybe hurdles are the policy questions. And we are looking forward to your talk, Pascal. Pascal is a full professor for bioethics at the Center of for Biomedical Ethics and Law at the University of Leuven in Belgium. His main research focuses on ethical, legal, and social questions in genomics policy and genetics. He published extensively among other issues with a focus on public health, genomics, consent policies, return of results, and return of variants of unknown significance and consent issues. He's also the director of the program for a Master of Bioethics at the University of Leuven and serves as at a number of ethics councils in Belgium, but also at the European and international level. For example, on genomics policy questions, for example, also on the regulatory and ethics working group of the Genomics Global Alliance for Genomics and Health that we just learned about from the Broad Institute. At least that's where we once met. And he is also an invited scholar and collaborates with the Center for Genomics and Policy of McGill University in Canada. So we are very happy to have you and to learn from you about challenges and potential solutions that we are very interested in for genomics data sharing policies, since we are creating this in Germany with GHGA, and happy to learn from Belgium. The floor is yours, Pascal.
Thank you very much for this invitation. And so what I would like to talk about today is a topic that was already addressed many times in the previous talk. So I hope not too much fall in repetition. If we think about data sharing, I think we have already heard the importance of bringing data together in order to optimize the use of data sets, in order to facilitate validation of research results, facilitating innovation of methods and tools for research. This creates, of course, quite a lot of questions, and I think some of the previous presenters referred to that already. Issues with regard to the sensitivity of data and privacy protective measures that are already being taken to make sure that privacy concerns are raised. Are addressed. Issues with regard to the use of data beyond its original purpose and used by third parties as a concern that has often been mentioned. Not so much found to be happening, but often mentioned. The potential of using data for other research purposes, and that's an interesting development, because I think what we learn as well is the importance of using data and not always with a hypothesis in mind, but using data more and more from the data itself. And I think one of maybe the main issues that we need to address, and I will come back to that, is some professional concerns. Thinking about issues of authorship, as was already mentioned, about rewarding people that collect data and make data available. What are the best mechanisms to make sure that data generators are being recognized, and which could be as well a kind of a limitation if not addressed properly, because the data might not be shared because, for example, of competition concerns. If we think about genomic data sharing specifically, I think we should look from the start already of the Human Genome Project, where genomic data sharing was really integrated from the start. Thinking about, for example, the Bermuda principles, where automatic release of sequence assemblies was being advanced, where immediate publication of finished annotated sequences were advanced, and making sure that entire sequences were being entered in the public domain in order to maximize benefit to society, and making sure that it would not remain in the hands of some individuals or groups just for private interests. In 2003, we see that some of these mechanisms were being repeated in the Fort Lauderdale Agreement, and what is, I think, important, and I already referred to that this tension that was already referred to as well was acknowledged there already. The fact that this might, that the notion of data sharing might conflict with own personal incentives related to scientific development, thinking about competition and dealing with this. When we think about data sharing, I think it fits within a bigger purpose of open science and an open data movement, and making sure that data, certainly data coming from publicly funded research, is being made publicly accessible, and we have seen many documents endorsing those principles. However, we realize that despite these open science ideals, that data sharing is still not a common practice, that it is not always requested by journals, and a study showed that only 12% of data sharing was required by journals. And we see as well that even published articles in journals don't always comply with data availability request as requested by the journals. So we see that still a lot of barriers exist. Fears of getting scooped, fears of competing analysis by other groups, fears of potential misinterpretation, fear of misuse of data. There are as well lacks of resources, financial resources or others, that might hinder sharing data. The privacy concerns are often being used as an alibi for not sharing data. And there might as well be some lack of professional rewards for people willing to make their data available. And nevertheless, I think, as already referred to in the talk about the importance of data sharing for rare diseases, for example, we see that the importance of making data accessible is more and more being put forward. As well in the context of a clinic, for example, with this statement of the ACMG. We see, however, that still barriers exist, and I just want to emphasize here in the clinical context that data sharing is not still not I would say an self-evident things. Often there is has not been considered as an urgency, because very often clinical centers have their own centers of expertise and about certain conditions, and don't always see the added value of sharing this outside that community. There is some disincentive sometimes in frameworks and at the national level, because some certain centers might come into competition with each other. There is of course a cost linked to share data, and I think too often social, legal, and economic concerns are being put forward as a reason not to do that. And maybe one element that I would like to emphasize as well, for those that don't know that specific case, is that's a case of Myriad Genetics, where there was a lot of debate about making sure that data becomes as well a kind of an important property, knowing that if you have the data, you can disallow access to relevant information, and that was what was happening in the case of variants related to BRCA, where variants were not put in a public database and therefore not accessible for centers that analyzed BRCA genes. So going back to the discussions as we heard in some of the previous talks, if we think about genomic information as information that was completely anonymous, not to be identifiable, then data could be shared in an open, accessible way. But we all know that since at least 1 decade, that a lot of concerns have been raised about re-identification possibilities related to genetic data. Some studies have shown that, thinking about Janif Ehrlich, about the possibility, for example, of re-identifying people from the 1000 Genome Project. And for that purpose, a lot of the infrastructure that was built in order to increase availability to data has developed a system of controlled access, and just trying to refer you to some of our work in that domain. Linking this to GDPR, and for those that are not aware or familiar with it, so GDPR as a legal framework, I'm not a lawyer myself, but I have been forced to engage a lot with this regulatory framework. Is a framework that regulates the sharing or the processing of what is considered personal data. And personal data means any data that could lead to an identification of an individual in a direct or an indirect way. And I just want to refer that genetic information has been added to that list. That was not the case in the previous regulation before that, in the directive that was in force before the regulation that was came into entry in 2018. Terminology often used is a terminology of pseudonymization. This means that the notion of a key, that you are providing a code between your data and an individual, and as long as that key exists, you are talking about pseudonymized data and personal data. The biggest difficulty, and I think it relates to one of the previous talks earlier, is like, from which moment can we really talk about identifiable data? And if you look at the regulation, they would say like, well, to determine whether a natural person is identifiable, account should be taken of all the means reasonably likely to be used, such as singling out either by the controller of another person to identify the natural person directly or indirectly. And of course, the big issue is like, what does that mean, reasonably? And that's something that usually lawyers would not explain, and would in kind of would be open to interpretation. And if you look at what reasonable means, then you need to take into consideration what does it cost, what amount of time is required to identify, what is the available technology at the time of processing of technological developments available that could be used to re-identify. So that doesn't really give a clear answer to that. I think the only thing that is very clear is that if you talk about anonymous data, and this means irreversibly anonymous, then you don't have to fulfill the requirements of the GDPR. I just want to show this spectrum. I think that's for your information. I think being member of an ethics committee, I have to say that I often see very strongly confusion about this spectrum, about what it means to be anonymous or de-identified, and irreversibly de-identified compared to pseudonymized. So I think that's I think it's terminology in that sense matters. But if we take for granted that well, genomic data could be lead to in a reasonable way to identification, and I think that has somewhat become the consensus view that access to genomic data should be protected. We see that a lot of mechanisms have developed to develop controlled access to genomic data. And a lot of the mechanisms of principles in relation to how to process data, I mean, can become clear here. Is like it should be lawful, fair, and transparent. You should process data only in relationship to the original purpose. You should not collect more data than necessary. You should remove data that is not being used. You should ensure data integrity and confidentiality. And it's very often, I would say, if you have this kind of discussions that I had with DPOs, it's very often difficult to strike this balance, because as a researcher, you want more data, you want to keep it longer, you want to use it for more purposes. And I think if you have a very strict approach, then you might lose a lot of opportunities, in my view. If we look at the legal basis, and I think that's really important, if you process data in view of the GDPR, you should emphasize, or you should use at least one of the legal bases. And in my view, very often after the implementation of GDPR, consent has been advanced as a way of processing data. However, I think from an academic perspective, I think it's much more better to use other legal grounds for processing data rather than consent. And I'm thinking here specifically about public interest or legitimate interest. And we see as well that GDPR gives openness to that, because you can see that it mentions research as a potential examples of reason of substantial public interest. And Working Party 29 includes as well scientific research as a legitimate interest to process data. And I think these are really elements that we need to take into consideration. I would like to emphasize that an ethics informed consent is not necessarily the same as a legal informed consent. This means that you can include participants in a study, in a prospective cohort study, let us say, and you inform them about the study, you let them approve and provide informed consent for participation. You can do that from a perspective of a law on human experimentation. But on the level of the data processing, you might still claim that the data that's being processed is not based on consent, but is based on legitimate interest. And I think from an academic point of view, I think I would prefer, I think there are good reasons to prefer that approach. If you think about then further use, of course, you should have, whatever the legal grounds, you should have legitimate, appropriate safeguards for processing data, organizational and technical. We heard already quite a lot of the efforts to make sure that this is in place. You should have processes of pseudonymization, processes with regard to data minimization, approval from ethics committees or data access committees. And you should as well work on transparency and fairness with regard to the processing of data at the institutional level, for example, or at a research project level. This could be done. Thinking, for example, at our institution, every participant integrated in a study gets access in their own medical file about in which studies this data is being used. So they just can get an overview about like in which studies my data is being integrated in, and these are typically, this is clinical data, so typically not data for which informed consent has been given, but so we are able to integrate that, and we are still transparent and fair at the level of what is happening to data. So this means that informing is not always the same as letting people sign an informed consent. So going back to a lot of the data sharing in genomic data projects and consortia, where very often informed consent is being given. we see that controlled access mechanisms have been integrated and very strongly, very differently implemented in dbGaP versus EGA from a centralized or a decentralized model. I don't want to continue. We have had already introductions to that. The interesting thing about a controlled access mechanisms is that, of course, you can control who gets access to data, for which purposes. You can monitor the use, you can ensure accountability, you can sanction, well, I'm not sure if you can sanction, but you can at least kind of monitor for what purpose data has been gathered and see if other purposes are being followed up. And what is, I think at that level, you of course, you create a hurdle. That's, I think, might be that less data is being accessed. And what I have seen is that the creation of this controlled access mechanisms well, created as well some difficulties. And what I mean is that it's nice to build infrastructure. The problem is with infrastructure completely built with regard to controlled access mechanisms, it's not a guarantee that this system will work. And that's precisely what we have seen by doing an interview study in which we interviewed people that are data or monitoring data access. It is a system, I think, definitely that still needs to develop and grow as a governance mechanisms. We saw quite a lot of difficulties in the functioning of those data access committees. So data access committees as a way, as an instrument to control data access, but very often, certainly in the EGA model, composed of principal investigators or postdoc or a researcher and creating difficulties in sustainability of asking requests and I think growing. I think there are more and more institutions thinking about, should we not develop this at an institutional level rather than at an individual PI level or research group level. So these were two studies in which we reported about this data. If we asked people making decisions about access to data, we mainly saw that well, difficulties in acknowledging the role of or having clarity on the role of a data access committee. We saw, first of all, that not completely an agreement to what extent concerns about privacy and re-identifications were real, and therefore about the necessity of developing an access committee procedure. Difficulties, on the other hand, recognizing the importance of having a data access request mechanisms in the sense that it recognizes the efforts of the producers of the data and allowing data producers as well to engage with groups that that are asking for access to the data. There was some discussion about the need or not to check the proposed use of the data. I mean, first of all, people saw this as like, is this in line for which we connected the data? There were some examples of possibilities of seeing like, okay, are there certain uses we would consider to be inappropriate? And the ability to see if the requirements of the home institution with regard to ethics approval are being followed. However, there was discussion about, for example, the scientific review is necessary. So there was kind of the question like, well, what is our role in evaluating the scientific validity of an of what people wanted to do with the data. Some people said like, well, we don't want to give access to our data for those purposes because this would give negative insights on our data. So there was some ambivalence, at least on regarding the responsibility of data access committees on this role. One of the main objectives of a data access committees, as I said, is like, well, you can ensure what is going to happen with data. You can as well kind of having an oversight about who is accessing data. And a concept that is often being advanced is like, well, the researcher that can request the data that could be or should be a bona fide researcher. What we saw in practice was often a difficulty in interpreting, like, what is this bona fide researcher? Is that a professor at the university? Is that a researcher at the university? What do we do with master students? What do we do with citizen scientists? So who should be given access to? And there was different practices were being realized on this element. And as well, the view that even, well, that it's quite hard to have an oversight of what's happening to data. And you cannot really go back and see. So it's as well a matter of trust. A difficulty that participants as well were being confronted with is that the consent was not always available to data access committee members, that interpreting new research uses or research applications in view of existing data that was collected sometimes over long periods was not always easy. That there was a need, considered a need to having new mechanisms of involving data subjects. And that certainly with regard to consent, that more standardization is desirable in order to make sure that there is a better interpretation for which purposes data can be used. Then I would like to, and that's the last part of my talk, I would like to raise one of the issues or difficulties that were being addressed in data sharing and giving access. What we saw is that very often researchers feel kind of an ownership of about the data that have been gathered, feel as well expectation of keeping control over further downstream uses. And that has sometimes a negative impact on independence of data access committees, because there is sometimes, and certainly if the PI alone is making a decision about giving access, well, this might create conflict of interest and creating that some groups, research groups, might just not ask data, and others, so the data generators might often ask or put requirements on further data use, thinking about authorship and bringing a lot of discussions about appropriateness with regard to authorship criteria, which brings something, some people have argued that it might be better to develop into committees that are independent from the research groups in which data was generated. And emphasizing as well the role of funding organizations in building infrastructure for making or enabling that process of access. I think that, and going back to what we discussed as well, thinking about data access, we probably need to think better and more about in which way we can recognize data generators much better than we do now. I think the only mechanisms that we have at this moment accessible to recognize the data generators are, is often authorship. And this brings some issues with regard to research integrity. Think about the proliferation of authors on papers, where you really come to questions about who to include and under which conditions. Probably we need to think about alternatives as well, about recognitions of the specific data sets. How can you recognize data sets? Maybe we need as well data journals in which you have more journals that are being described, so that you have an other way of more data metrics as well, where you can have other ways of recognizing data generators. You have embargoes as well, and moratoria on data access, having raised as well some discussions. I will not go into detail about that, but I think what is important that we have certainly in the development of data governance and data access committees, well, I think some improvement to be done in order to improve, I would say, the accessibility, transparency on the type of access. And just for the sake of time,
sorry to interrupt. I think we have to kind of summarize to have the chance to get to the question round.
Yeah, absolutely. I just wanted to do that. So I think based on the discussions on controlled access mechanisms, we have seen that there have been as well advocates for moving to registered access systems, where it's more about building a system where you authorize someone to access where the data remains where it has been placed, and that you are doing analysis on the data on the system itself, so that you have a full overview about what's happening. And I think that could be ways of making this possible. And I just want to end about the necessity, I think, to reward people that I mean, finding ways. I think we should think about finding ways of rewarding people that are generating data, making it accessible, and that we might think about data journals, data publications, altmetrics, and so on, maybe data level metrics as well, so that we emphasize more within the notion and the framework of open science, the broad accessibility to data. And with this, I would like to end my talk. Sorry for taking a little bit longer.